Karibu for our class today. I'm Mwalimu Festus. Metformin is a drug used for diabetes type 2, but it is underrated. We need to understand it. Uses, dosage, and side effects are very important. So the first thing is that it's used in type 2 diabetes, as I mentioned, controlling blood sugar. And it has been used for polycystic ovary syndrome, PCOS now, it is called PMOS. And it has been used for sometimes for pre-diabetic management, and improved insulin sensitivity makes its usage be the most used anti-diabetic medication. So the standard annual dose for type 2 diabetes, it usually starts with 500 mg OD, or given once, or BD given twice for a day. It is usually taken with meals because it has highly insulin sensitivity, going to increase sugars, and therefore titration should be gradually increased from 1,000 to 2,000 mg daily as tolerated. We usually have now extended release given once daily with the evening meals. Extended dose is taken once daily, usually taken with meals, evening meals. So you have to tell your patients as a pharmacist or nurse that they should not crush the tablet or chew. They should swallow it a whole tablet. And you should adjust the dose based on the kidney function, and that's why they need to consult a doctor, a physician, or nephrologist, or a medical doctor, because most of them are buying this medication continually without a review by the nephrologist or physician, and it poses some common side effects, and that's why I'm here to talk about its cause, like nausea and vomiting. So many patients have nausea and vomiting, but it starts from the first week and it goes off with time. But if it exists, if it continues, and a patient has diarrhea, stomach upset, and gas, loss of appetite, that metallic taste, if it persists, you need to see your doctor. Then there are serious or severe side effects that they need to be aware of. You need to tell your patient about lactic acid. Patient may develop muscle pain, weakness, trouble breathing. So if they develop this lactic acidosis issue or liver issues, which are rare, and also there is also vitamin B12 deficiency. If they develop these problems of nerve neuropathies, nerve problems like neuropathies, peripheral neuropathies, hypoglycemia, let them see the physician, because men have been taking metformin and having side effects without reporting to their doctors. Usually some of the old people, they don't go back for clinic. Once they were diagnosed with diabetes, they continue taking medication without going for clinic. But nowadays, the doctors and the clinics are trying to reach them through the mobile phone. The technology has increased, telemedicine, telehealth. So make sure as a nurse or pharmacist, you make sure your patients in MOPC clinics, they are able to report these side effects, because some of them are suffering in silence. Thank you.